And then if we go to Africa, this has been a continent that we've been talking a fair bit about in TraceLink. We talk a fair bit about it in the GS1 public policy work group as well, that TraceLink is very active in. I would say the next decade is almost going to be the decade of Asia Pacific and Africa. There's been a lot of concern. I think many of you have seen many of the reports of the level of adulterated or counterfeit or poor quality medicines in Africa. It's an area where the healthcare systems are growing very fast, but the infrastructure has not been keeping pace. It's an area actually that we've been talking with USAID, who provides a lot of aid to sub-Saharan African countries, because USAID is trying to work with the governments and saying, we want to put aid into the country to improve the medicine supply, but we want to make sure that it's used efficiently. So one of the things that USAID has been doing is partnering with organizations like GS1 and with end users, with stakeholders, to try to figure this out. So actually, we just came off of the second African conference under the GS1 Global Healthcare banner. My partner in industry and community, Alan, was there talking with many of the regulators, talking with many of the stakeholders, with the ministers about this. We're early in this process. Many countries have done some initiatives in the past. Sometimes they did stickers, sometimes they did mobile device scanning of medicines that were done more as one-offs. A lot of that, I would say, was informing what the continent has to do. There's not a lot of local funding, so they do rely on government organizations to help to support the medicines and to fund many of these initiatives. And I think one of the challenges is you can't just talk to the government then. You have to talk to who the aid organization or organizations are. So there's sort of a lot of people that are at the table in these conversations. One of the things that came out very clearly at the GS1 conference was a lot of interest, a lot of desire, a lot of concern for the patients in those countries. Not a lot of clarity about where to go forward. I think one of the things that Alan very much came away from that is things will be happening in the next decade. But again, like we've seen globally, not everybody's going to do it in lockstep. Not every country is going to follow the same recipe for it. There's going to be some leaders, Nigeria, Ethiopia, et cetera. And then there's going to be some countries that will maybe follow those leads, and other countries that will do their own thing. But if you see some of the list of the participants there, there were many active voices, many people saying, how are you doing this? Or our patient supply and our medicine supply is organized like Y. Do you have any ideas of how we may be able to think about this? So I think there's a lot more to come in sub-Saharan Africa. I think it's a great opportunity for learnings from what we've done elsewhere in the world, learnings from TraceLink, learnings from all of you, to then say, can we create a blueprint and can we help to inform these governments, inform these ministers, inform USAID of here's the right way, or here's some better ways of approaching supporting the medicines across the globe.